Hi, my name is Celine and I'm a PhD candidate at Brock University.
Hi everyone, my name is Sukhdeep Kaur. I'm a master's graduate from Brock University.
The title of our study is Substance-Related Acute Care Disparities by Sexual Orientations in Ontario.
Despite increasing rights and acceptance in Canada, many lesbian, gay and bisexual individuals continue to experience discrimination and minority stress.
These unique stressors can include family rejection, workplace and school bullying, social isolation, and discrimination.
Based on US statistics, LGBT individuals report 2 to 4 times more substance use compared to the general population.
However, we do not have similar substance use statistics by sexual orientation in Canada.
To date, the evidence of substance use for LGBT individuals in Canada is based on self-reported information. This could result in an underestimation due to social desirability bias. This is where participants may not be willing to disclose substance use habits because of social stigma.
The use of health administrative data is needed to provide a more accurate picture of the substance use disparity across sexual orientations, especially with regards to severe events.
The research we will be presenting today will contribute to a deeper understanding of the patterns of substance use across sexual orientations in Canada, which is essential in the development of hospital and public health policies aimed at reducing potential disparities. Our study will also investigate how socioeconomic status could further modify substance use disparities.
We wanted to examine this additional dimension because poverty is a fundamental social determinant of health, and it may compound or exacerbate the effects of LGBT minority stress.
Our project will answer the following questions. Does substance-related acute care differ across sexual orientations in Ontario? If so, does individual-level socioeconomic deprivation modify the substance-related acute care disparity by sexual orientation?
Our study cohort is created by using linked health administrative data from 2002-2017 for each participant gathered from the Canadian Community Health Survey. For our outcome, we used the ICD-10 classifications to identify different types of acute care-related events. This could be including alcohol, marijuana, opioid, and other drug-related substance use events.
Sexual orientation was captured using the question, do you consider yourself to be heterosexual, homosexual, or bisexual?
Further options including don't know, refused, or not stated were collapsed into a single group and labeled as others.
Individual SES represents the personal opportunities that an individual has access to as a result of their education, income, and occupation.
To examine the effect of socioeconomic deprivation, we use education level to represent individual SES. Education has been shown to be a valid predictor of individual SES and may be a preferred measure compared to household income, as LGBT individuals may be ostracized by their families and may not have access to family resources.
And to answer our first research question, we conducted discrete event history analysis stratified by sex to examine if LGBT individuals were more likely to have a substance use-related acute care event compared to the general population.
Discrete event history analysis is a logistic regression model where the unit of time, measured in years, is included as a dummy variable.
We will present the calculated hazard odds ratios using logit estimates to show the disparities in substance-related acute care events across sexual orientations.
For the second part of our research question, we included interaction terms between SES and sexual orientation and not discrete event history regression while controlling for confounders.
For the next analysis, we included participants over the age of 25, where education can be a stable proxy for SES. We calculated the fitted rates for each substance use-related outcome using predicted probabilities at representative values to interpret the interaction effects. We conducted a first difference test. We then followed it up with a second difference test to understand whether the predicted probabilities of sexual orientation on substance use-related events are contingent upon SES, holding all else constant.
In our study sample, approximately 3% identified as LGBT. What you see now is the relative risk of substance use-related events for sexual minorities compared to heterosexuals. A red cell indicates that a particular group has increased relative risk to heterosexuals for a particular substance, and a green cell means that it has lower risk. For example, the first red cell with the number 1.63 indicates that female homosexuals have a 63% higher chance of an acute event of any substances compared to heterosexual females.
With heterosexual women as the reference group, looking at the table, we can see that bisexual women are the most at-risk group, where the hazard ratio was 2 times higher across all substance use acute care events. While lesbians have an increased risk for any substance use acute care event, the risk is more prominent for alcohol and cannabis-related events. Although our results show a decreased risk of alcohol-related events for other, the ambiguous nature of this category impedes any further interpretation of these effects.
Meanwhile, for men, when compared to their heterosexual counterparts, gay men were at higher risk for only other drug-related events, while bisexual men were at a higher risk for only cannabis-related events.
Our second research question is about whether socioeconomic deprivation amplifies the disparity in substance use events across sexual orientations. So I'm going to explain the predicted probabilities in the table that's shown now. For example, let's look at the first number in the first row. It means that there are 0.44 more events per 100 people for homosexuals with low SES compared to heterosexuals with low SES. Moving on to the second row, we can see that there are 0.22 more events per 100 people for homosexuals with high SES compared to heterosexuals with high SES.
Now looking at the third row, we can see if SES modifies the effect of sexual orientation on substance use. The 0.22 here represents the difference between low and high SES when you compare homosexuals to heterosexuals.
Our study findings show that while sexual minorities suffer from additional risks relative to heterosexuals, low SES can amplify that risk even further. You can see from the table that across almost all substances shown here, with the exception of homosexuals under other drugs, being lower SES amplified the effects of being a sexual minority. You can also see that bisexuals with lower SES are the most affected. Using health administrative data, our study provides evidence that LGBT individuals, particularly bisexual women and lesbian, and to a lesser extent, gay and bisexual men have a higher risk of substance use-related acute care events in Ontario. The evidence presented in our analysis supports the development and testing of policies and interventions to reduce severe substance use events across sexual minorities. Here are a variety of settings where we can test policies to reduce substance use acute care disparities. Frontline harm reduction, such as harm minimization booths, can be a cost-effective intervention to reduce substance misuse and provide individuals with health resources. Since the venues and events where LGBT socialization takes place have access to alcohol, there should be increased funding to organizations or public health units to provide these services in an accessible and educational format.
The high risk of substance-related acute care among LGBT individuals emphasizes the need to ensure that primary care providers and clinicians
should be prepared by being culturally informed and understanding of the needs of LGBT individuals. According to a report by EGAL, 54% of healthcare providers say they have never received training in cultural competence with LGBT populations.
having either culturally informed services or LGBT specialized treatment can improve substance use treatment outcomes.
Gay and bisexual men were significantly less likely than heterosexual men to complete traditional substance use treatment. But this disparity is not presented when LGBT specialized treatment is provided to gay and bisexual men.
Organizations like Rainbow Health Ontario have training for clinicians across Canada interested in working with the LGBTQS community. Ontario's Ministry of Health should consider providing additional funding to course-based learning program platforms to increase the clinical and cultural competency of our healthcare providers. In addition, we reiterate the recommendation made in the 2019 report of the Standing Committee of Health that the Government of Canada work with provinces, territories, and provincial health professional and regulatory bodies to establish a working group to identify ways to promote training and education of healthcare professionals about the health needs of sexual and gender minorities.
Although we have found evidence of substance use acute care disparities in Ontario across sexual orientations, it is important to health outcome surveillance of the LGBT community to further understand patterns of substance use.
Government public health agencies like Public Health Agency of Canada should provide funding to public health units to focus on the monitoring of both substance use acute care events and socioeconomic factors such as SES. This monitoring will help provide rich data for future research that can examine other contextual factors which contribute to the substance use disparity.
We would like to thank McMaster RDC for working with us and providing us with the data.
Thank you for listening to our talk today.
Thank you for listening to our presentation.